Hello, I'm Dr. Tony Vuturo, Senior Vice President of Canyon Ranch in Tucson. I would like to share with you some of my recollections on the events that led up to the 10th anniversary celebration of the Mel and Enid Zuckerman College of Public Health. My comments cover a 25-year period from 1971 through 1996. These events facilitated the establishment of the Mel and Enid Zuckerman College of Public Health. The medical school was established in 1968. Among the first departments established was the Department of Community Medicine. For a land-grant institution, this was considered a major addition. Arizona had thousands of miles of rural areas. Native Americans, both on and off the reservation, were throughout the state. Waves of new immigrants, predominantly from the south of the border, were coming to Arizona, seeking their share of the American dream. Monty Duvall, the founding dean of the medical school, recruited Herb Abrams from Chicago to lead this new department. Two recent graduates, Andy Nichols and Tony Vuturo, both with master's degrees in public health from Stanford and Harvard, joined Herb, Al Leonard, Ray Shaw, and Jesse Tapp. This rounded out the core faculty. From this group, the vision and plans for public health education and service were put into focus. Public health activities began with the establishment of the El Rio Neighborhood Health Center by Herb Abrams. Among the first recruited to advanced training in public health was DeLeep Ball. He, like so many graduates, went on to a distinguished career in public health. He is a former honoree of the Zuckerman College of Public Health, head of the Pima County Health Department, director of adult health for the state of California, and past president of the American Cancer Society. In the mid-70s, community medicine expanded to include family medicine, preventive medicine, occupational medicine, fellowships in geriatrics, faculty development, and sports medicine. The department changed its name to the Department of Family and Community Medicine. Into all of these programs, the practice of public health was integrated. The residency program in preventive medicine and occupational medicine were established. The American Board of Preventive Medicine required an academic year of training. There were no MPH programs in the Southwest at this time. The academic year was the forerunner of the MPH degree and was actually called the MPH equivalency in recruitment brochures. The new Department of Family and Community Medicine grew, with public health and primary care as the core domains. The faculty continued to grow. Growth was spearheaded by Andy Nichols and Allison Hughes in rural health. Gail Harrison, with expertise in nutrition, recruited Cheryl Rittenbaugh, Ron Watson, Iman Hakim, Osman Galal, and Doug Tarrin. A prevention center was started, and Kent Campbell was selected to lead this undertaking. The academic infrastructure in the Department of Family and Community Medicine was woven around the MPH equivalency and its potential. Graduate students from around the world were coming to the university to work with faculty whose disciplines were in public health. New educational technologies were not ignored. Ron Weinstein, Allison Hughes, Rick McNeely were all instrumental in incorporating into the educational environment telemedicine, telemetry, and teleconferencing. All became the forerunners of the current distant learning programs in the College of Public Health. Dr. Mel Goodwin was recruited from Phoenix. He reoriented the MPH equivalency to an actual University of Arizona public health master's degree. After numerous attempts through many committees, including the Regents, this degree was approved. There was a continuous need for community support for public health. Mel and Enid Zuckerman, Roy and Sally Droquin, stepped up with commitments for the program's faculty, facilities, and new programs. Epidemiology, nutrition, statistics, health services, maternal and child health, environmental sciences, international health, Native American health, and gerontology were in place, along with the approved Masters of Public Health degree. Hundreds of individuals contributed in very special ways, keeping the programs running smoothly and supporting the momentum for public health. Administrative assistants, secretaries, program coordinators, accountants, procurement specialists, managers of grants and contracts were among a few of the supporting cast. All were committed to the public health needs of this state. Beth Smith, Pat Sorotka, Wendy Schwartz, Linda Tomelli were but a fraction of those working under the tireless direction of Marge Ford, the senior financial manager. They worked in 15 different facilities around the community to improve the health of the public. All made what the faculty did a reality. These legions of professionals contributed to today's festivities and the 10th anniversary of Mel and Edith Zuckerman College of Public Health. Prior to my stepping down as chairman of the Department of Family and Community Medicine in 1992, an extensive departmental review was put into place by Jim Dolan, who was the vice president for health sciences. Major recommendations of the external review committee were twofold. First, the existing department was scattered into too many facilities in Tucson. This prevented the collegiality and cross-fertilization of ideas. Second, all the ingredients were in place to consider the formation of a new college, the College of Public Health. That is what Jim Dolan implemented. Tony Vuturo transitioned to the office of the dean. He served as Jim Dolan's associate dean for health affairs and assisted with the evolution of the College of Public Health. As Walter Cronkite would say, and that's the way it was.